गुड मॉर्निंग एवरीवन। मैं वैद्य योगेश पांडे आप सभी का रस हृदय फार्मेसी की तरफ से इस भस्म सीरीज में स्वागत करता हूँ। भस्म सीरीज का ये दूसरा सत्र है। हमने पहले सत्र में वैद्य पार्थकारे सर से भस्म कल्पना इसका इंट्रोडक्शन एवं उसकी विशेषताएं इस पर चर्चा की थी। तो आगे जैसे मैं हमने कहा था कि इस सीरीज में हम स्वतंत्र एक एक भस्मों पर चर्चा करेंगे। तो आज का जो विषय है वो सोमनाथीय ताम्र भस्म है। तो सत्र शुरू करने से पहले हम रसेश्वर पूजा और धन्वंतरि श्रवण करेंगे। शुद्धस्फटिकसङ्काशं पङ्क्षवक्त्रं त्रिलोचनं ज्वलत्पिङ्गाग्रणीतज्वलज्जिह्वाननं तथा ज्वलद्भुवं जलत्केश्यं विप्रेष्य प्रेतवेष्टितं जटामुकुटसंयुक्तचन्द्रार्धधृतशेखरं व्याघ्रचर्मधरं नागोपवीतवृषभध्वजम् अष्टादशभुजं देवीशक्तः सितानां तत्सत्सङ्गे महादेवी रत्नाभरणभूषितम् उपतप्तैः मुरुचिरां पीतवस्त्रां त्रिलोचनं श्वेतचामर्योर्मध्ये मुक्ताचत्रेण शोभिताम् अंकुशं चक्षमाणां च ददति दक्षहस्तयोः वराभ्यां च वामाभ्यां चन्द्रार्धकृतशेखरं रसाङ्कुशं महादेवी नीलद्रुवातिलोचनम् ॐ शङ्खं चक्रं जलौकां तटतटं चारुदौर्भिश्चतुर्भिः सूक्ष्मसक्षातिरुद्यां शुकपरिविलसन् मौलिमम्भोजनेत्रं कालाम्बोदोज्ज्वलाङ्गं कटितटविलसच्चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं निखिलगदघनटौषधावाग्निमीनं। तो आज का जो सत्र है सोमनाथीय ताम्र भस्म का, ये दो सेशंस में विभाजित किया गया है। पहले सत्र में वैद्य सतीशा रंजनागी सर सोमनाथीय ताम्र भस्म का क्लिनिकल एस्पेक्ट सामने रखेंगे एवं अपने केसेस से इस भस्म की व्याप्ति समझाने का प्रयत्न करेंगे। तो मैं सर का स्वागत करता हूँ और प्रथमतः उनका औपचारिक इंट्रोडक्शन करना चाहता हूँ। डॉक्टर सतीशा रंजनानी सर ने अपना BMS एवं MD रसशास्त्र इस विषय में डिग्री प्राप्त की है एवं फिलहाल मॉलिक्यूलर बायोलॉजी रिसर्च में काम कर रहे हैं। सर की स्पेशलिटी रसभस्म एवं पारद से बने कल्पों पर क्लिनिकल प्रैक्टिस, ये सर का प्राधान्य है। सर फिलहाल मोक्ष इंटीग्रेटेड मेडिकल एंड रिहैबिलिटेशन सेंटर बैंगलोर यहाँ पे सीनियर कंसल्टेंट के पद पर है। इसी के साथ श्रेयस रिट्रीट आयुर्वेद सेंट्रल दोबलपुर में कंसल्टेंट की तौर पर है। सर का एरिया ऑफ एक्सपर्टीज है कि सर स्पेशलाइज ट्रीटमेंट करते हैं। जैसे मैंने कहा कि रसभस्म और रसकल्पों का उपयोग ज़्यादातर करते हैं। मेजॉरिटी डिसीजेज जो वो अपने ओपीडी और आईपीडी में प्रैक्टिस करते हैं उनमें से कुछ ऑटोइम्यून डिसऑर्डर्स, न्यूरोजेनरेटिव और न्यूरोलॉजिकल डिसऑर्डर्स, मस्कुलर डिसीजेस एंड पेन मैनेजमेंट, मेटाबॉलिक डिसीजेस और लंग डिसऑर्डर, ऐसे कुछ विशेष व्याधियों पर सर विशेष चिकित्सा करते हैं। तो आज के इस सत्र में सतीशा सर हमें सोमनाथीय ताम्र भस्म इनके क्लिनिकल उपयोग में कहाँ कहाँ आता है इसके ऊपर मार्गदर्शन करेंगे। सो आई रिक्वेस्ट Satisha sir to speak. Please start his presentation.
Yeah, thank you, Dr. Yogesh, and good morning, everyone. So today, without wasting a time, let me start my topic. It is about Somnathi Tamra. So Somnathi Tamra, it is one of the special preparation which is mentioned in our textbooks, and it becomes very unique because of its the way what are the ingredients and the way of preparation, and also the ingredient, it makes it very stand different from the different bhasmas. It is kind of a, you can think this is a one kind of a combination of the multi-facet combination bhasma. So let's start. Okay, let me go through first how the Somnathi Tamra shloka starts in Rasaratna Samuchaya. It is in the 5th chapter. In between 64 to 67 shloka, it has been explained. Shulbhatullena, Sutena, Balina, Tatsameva cha, Tadardanshena, Talena, Shilayacha, Tadardaya, Tadroga Anupana Sahitam, Tamram, Dvivalla Vitam, Salidam, Parinamashula, Udaram, Shulancha, Pandujwaram, Gulma, Pliha Yakrit, Kshayagni Sadanam, Mehancha, Mulamayam, Dushtancha Grahani, Harit, Droidam, Sri Somanatham Vidam. So, this is the expression. In between, there is a how to prepare it and all those things, it is there. But anyway, the way of preparation and everything more better than me, Dr. Patkala and his team is going to take. So now, I will start to explain why it is unique. So, the way shloka it is explained, it is a combination of Tamra, Paradha, Gandhaka, Haratala, and Shila. So if you look at all the ingredients are, everything is in the almost in the Ushnavira except in the Basavarajyam. He claims to be Tamra as a Ushna in certain contests that we will discuss in the furthermore slides. Now, introduction, if you analyze the combination, its composition becomes very, very unique, as I told. And what is the basic principle it goes? Why in the Somanate Tamra, Tamra is being merged with the Haratala and Shila. Actually, the Parada and Gandhaka, Kajali is a very common composition in all the preparation. So now, what is the importance of Tamra, Haratala, and Shila in that? What is the infusion of these things? How it become unique? And what is the clinical implication? Let's go through in detail now. So the combination is based on the very basic principle of samana guna, vriddhi samanai sarvesham, viparitai viparyaya. So now what are the different samana qualities, or what are the equalities in between these three ingredients? So I would like to take you through the journey. What are there is a rasa samana, there is a guna samana, there is a vira samana, and there is a doshagnata samana. Then there is a karma samana or falashruti samana or rogagnata samana, whatever you consider. So there is a means there is a similarity between rasa, which is present in that. There is a vira samana, there is a doshagnata, means the what it work on the different level doshik level. These three ingredients which work on the doshik level, which also there is a equalities, and also the karmakata samana. Now, one simple example, let's take. If you consider rasayana as a guna or karma, there is a bit of a discussion on this. Rasayana, if you take it as a quality or guna, then there is a rasayana property which is existed in Tamra, which is existed in Haratala, and Manashila. Rasaratna Samuchayakara says it is one among the Manashila is rasayanagra. Apart from gold and Tamra, the next Manashila is the next thing which explains. It is a rasayanagra. Then comes Parada. Parada, as everyone knows, it is Achintya. And there is no pages, the pages are not sufficient to explain about Parada. It is a yoga bhayi. You take any quality, I can say, yes, Parada is going to possess that, Parada is going to possess this. So let's not to discuss about it. Parada is one among the Rasayana. So if you go by the Rasaratna Samuchayakara, who consumes Parada on a daily basis, like Parada Bhasma and all who consumes, they became Amara. That is the quality experience. So I don't need to explain much about Parada here. So here it is all Guna Samana. So when Guna Samana becomes the equal qualities are, equal gunas are there in this almost all the present. When equal qualities are being explained in all the ingredient which is explained in this particular preparation, what happened? Wherever there is a possibility of guna, you need to guna. There are treatment protocol. We can do it on the basis of guna. For example, how do you consider it? there is a Rajakshma presentation. There is the dosha depletions are there. There is a dosha vipaka is happening. So there is a totally the doshas we are not able to understand. There is a kevala vata vriddhi is there. But at the same time, there are Linavastha, in the Linavastha, there is a kapha. Then what to do? Then Somnathi Tamra is the choice. Because where you need to tackle vata without increasing the kapha. But at the same time, you want rasayana effect. You are not just looking at the angle of reducing the kapha vata. You are also looking at the increasing the rasayana qualities. Okay. What kind of a disease you need to understand? What is the disease you should take it? Okay, if you go by the rule of certain the chronic paralytic patients where the spasticity set in, then in that particular angle, you can use Somnathi Tamra, where there is a changes in the muscular system where you need to improve their Agni and all those things. All these three ingredient which does same time you are getting a rasayana effect as well. So like that, the guna samana you can consider it. Now comes rogagnata or falashruti samana, the karmukata samana. So the kushta. If you consider kushta, gandhaka is a kushtahara, tamra is kushtahara, tala is kushtahara, then shila, manashila. This is also kushtahara. Again here, when it comes to a different aspect, when the kushtahara, so gandhaka, everyone knows the gandhaka rasayana or gandhaka content, all the preparations are maximum. Everyone easily uses in all the skin conditions, what we treat and all those things. Again, tamra is a drug of choice. Then haratala. Haratala in manashila, there is the sraviyukta kushta. Then shila is asraviyukta kushta. So the mainly. So like this, there are some quality difference, but the end of the day, depend upon how you're going to purify and how you're going to prepare the different preparation, and tala and shila can be also used in the different varieties of kushta. So talakeshwara rasa, the talakeshwara rasa, everyone knows what is a means in a chronic condition, rogagnata quality and rasayana quality both existed in tala. So similarly, when you consider gandhaka, tamra, shila, then comes tala. So all this equal together, it gives you the impact of kushtahara property. So when samana gunas are mixing together, all together when it is acting, you can tackle the chronic skin presentation where mixed presentation is there. There is you are not sure whether it is going to be atopic dermatitis, whether it is going to be the other eczema. There is a presentation. Some days there is a oozing, some days there is no oozing. Then the physician get a bit confused. So sometimes they respond, sometimes may not respond. At that kind of a condition, these combination of combo of bhasmas or combo of these combinations will work in a better way. That is about the karmakata samana. So then comes guna samana. If you consider in the guna samana,
sorry to interrupt you, sir. So if you want to change the slide, please say a slide. We just change our slides.
Okay, no, I haven't started still on the.
Okay.
I'm
Okay,
just
okay.
in the introduction.
Okay, sir.
I'm in the introduction. Okay, so now Ushna Sama, the Veera Samana. In the Veera Samana, everyone, almost all the ingredient, everyone knows that it is all Ushna Veera only, either Gandhaka, Tala, Haratala, Shila, and particularly Parada. Everything is become Ushna Virya. So Ushna Virya itself is on the basis of Virya. Ushna Virya, if you consider Ushna Virya, you can easily treat the Vatika disorders by Ushna Virya. And wherever Ushna Virya is needed, we can use this particular. So on the basis of some, because there are many school of thoughts in Ayurveda, certain people based on the Guna, they treat. Certain people based on the Virya, they treat the disorders. Some people try to go by the Rogagnata. So based on the physician intellect, one can formulate the combination and they can use. So these are a very simple example of Guna Samana, Falashruti Samana, then Virya Samana. So because of possessing the Ushna Virya, then considering the fact of Karmakata Samana, with all these combinations, it becomes Tivra Guna Yukta. The Haratala and Manashila, all acharyas in every Rasa Shastra textbook, you can, if you go through it, it becomes Tivra Guna Yukta. So when Tivrata is there, when there is a Tivrata is there, it acts on particular condition in a very, very effective way. So it can be a choice of emergency management, and it can be used in certain emergency conditions. And it gives you the Falashruti in a quick manner in compared to the other bhasmas or other medication, I would say. Then the same times, if it is a Tivra also, it is not going to cause at the end of the day Vata aggravation, because it is Rasayana property, and it is also having a Ojo Vardhana property. How the Ojo Vardhana comes? Again, Manashila is a Ojo Vardhaka. So, like this, when you are studying any particular components, try to read and understand the Guna, understand the Rasas, understand the Karmakata. Sometimes understanding the Vipaka concept is also very, very important in understanding that. So, because of all the whatever I told in the introduction, because of those similar qualities and particularly the Oja Vardhana and the Rasayana property, it becomes a choice in the many of the deadliest diseases. So now let's begin with the session. I will let's run through the each composition of the drugs. So now the Parada, as I told you, Parada is Achintya. It is the completely attacked on it is Tridosha Shamaka. That's how it goes. Okay, let's begin with the now. Consider the Gandhaka first. As per the Rasaratna Samuchayakara, the Rasayana Gandhaka is having a Rasayana quality, Krumihara property, Madhura Rasa, Katuvipaka, Ushna Virya, Kandu, Kushta, Visarpa, Dadru. It is Agnidipaka, it is Pachaka, Amadoshahara, Shoshahara, Vishahara. So please, everyone knows these things, but please keep it in the mind, because when I'm going to explain the clinical implications, so these each one of you becomes very important. Again, the Basavarajiam, according to the Basavarajiam, it is again Rogahara, Kushtahara, Jarahara, Mrutyuhara. It is Agnikari, Mahanushna, and the Virya Vruddhi. It also helps in improving the Virya. Now, if you go to the Haratala qualities, it is Guru and Signa, Katu and Ushna Virya. It is Rasayana, Deepana, Shleshmahara, Rakta, Visha and Vata, Bhutahara. Then it is Kevalancha, Pushpavrutriya. Please let us analyze this Kevalancha Pushpastriya. Then it is also Kushtahara. Similarly, the Basavarajiam says it is Shleshma Vatahara, Vishahara, the Raktadoshahara, Bhutahara, Deepana. He mentions Haratala as a Shitala. Then Rujahara, Snigdha, Ushna, Katu, Lekhana, and Kushtahara. Okay. So now, if you look at the Haratala, why Acharya mentioned in the Rasaratna Samuchaya the Kevalancha Pushparutriya? It is one among the topic, and it has been discussed in among many scholars, and in many books it has been interpreted in a different manner. There is a lot of kind of a debate on this. Now, what is Kevalancha Pushpa Vrutriya? So when it comes to a clinical practice, when it is Kevalancha Pushpa Vrutriya, means many people consider the taking Haratala, the lady the ovulation in the ovulation can be interrupted, or ovulation may not happen. To prevent the ovulation, the Haratala can be used. That is the consideration. It has been given in the many of the books, and there is a lot of discussion between among so many people. But if it comes to the clinical level, if it is in the Haratala, if it is purified properly, and if you take it, consider in any yoga, like the Tala Bhasma, Tala Sindhura, or Tala Garbha Potali, or any medicine which contains thala in treating particularly the related to the ovulation, actually it helps in ovulation. It treats the vikriti of the ovum or ovary. So it treats the ovary vikriti. For example, you consider PCOD. In the PCOD lady, when there is a inappropriate ovulation is happening, otherwise there is no particular, the rupture is not happening properly, there actually there is a ushna guna is needed, and also the tivra guna is needed to make the appropriate rupturing of the ovum. So when the rupture action is to happen, so haratala with the qualities of ushna and tivrata, it helps in. But then what is the exact meaning if you go by the word? When you consider the haratala in unpurified state, or agrahya haratala when the person consumes in a continuous manner for several days, it may impact the ovulation. So here, the kevalancha considered to be a unpurified haratala. So when you are using haratala, make sure that preparation is good, the purification is good. So then definitely using haratala for a ovulation purpose in the ovulating lady, it is not going to impact. So now the remaining qualities I am not going to discuss in detail, because wherever there is some contradictions and there is some misunderstandings are there at the clinical level, at the theoretical level, only those points I am discussing here. Now, when it comes to a manashila, the manashila is according to the Rasaratna Samuchaya. It is a Sarva Rasayanagra. It is Tikta, Katu, Ushna, Kafavatahara. It is it increases Tattva, Bhutahara, Vishahara, Agni-mandhyahara, Kanduhara, Atikasa, Kshaya. Similarly, Yoga Ratnakara reference, if you take it, it is Guru in Guna, Varna, Sara, Ushna, Lekhani, Katu, Tikta, Snigdha, Shwasa, Kasa, and Bhutahara, Vishastra. So consider this again. Here we will discuss on the 2 points. One thing is Atikasa and another thing is Vishastra. So when the Vishastra, the Yoga Ratnakara very neatly explains Vishastra. What is Vishastra? The Vishastra, it helps in one among the emergency management. If you consider Vishastra, it can be, the Manashila can be a choice of, in emergency management, the Manashila can be a choice in several varieties of septicemia. In the septicemic condition, the Vishastra, if you go by the word Vishastra, if you analyze the pathophysiology, in several septicemia condition, it can be used in a, it can be one among the drug of choice. Then also, when you treat CA, especially the consideration of meds, when there is a particular the cancer markers which circulate in the blood, especially related to the pancreatic CA, then when it comes to a colorectal CA. So when there is a chances of the metastasis inflammatory markers which is circulating in the blood, then Manashila is the drug of choice. The second thing, during the autoimmune condition or any infectious condition, when there is a high C-reactive protein, high sensitive C-reactive protein, D-dimer, all these things are in the higher state. When you consider the blood is in the toxemic state, then Manashila is a drug of choice. So this is a way one can analyze the each qualities of the particular component, and you can use it in a appropriate manner. Then when it comes to Atikasa, then again Haratala is also Kasara, then Manashila is also Kasara. What is the need of two components to use it? See, when Manashila and Haratala, the major difference is Haratala, it perspiration of the means it, the Manashila, it dries off the excessive shleshma, means the mucosal secretions, what is excessively happening, the Manashila, it suppress it. But whereas Haratala, without suppressing, it purifies it, and which act as a bronchodilator. So considering those facts, in the broncholectasis, In the bronchiectasis condition, where there is a purulent sputum is keep on producing, in that kind of a condition, there is a hacking cough. To suppress that, you can use this particular Manashila. So when you're using Manashila, there is a chance of dryness in the chest. To nullify that, the Gandhaka and Haratala will help, and Haratala will take over post that thing. So that is one consideration of Atikasa. When it comes to another aspect of Atikasa, when there is a heart involvement, what we call particularly the cardiac asthma. In the cardiac asthma condition, when there is a exertional dyspnea and all those things are there. So especially this particular Atikasa concept, because they keep on coughing with the exertion and all those things, with the Vojovardhana property and Rasayana property. Vojovardhana property and Rasayana property, this Atikasa literally help. Again, this is also Shwasahara. Haratala is also Shwasahara. So please also one need to understand, when it comes to a Kasa and Shwasa, it is not just related to the lung. The Shwasa in our contest, in our books, whatever Acharya explained, it is also go through a many condition, particularly which simply goes towards the lung health as well. So this is about, in nutshell, about Haratala quality. Now, chief drug, Tamra. Okay, what is the when it comes to a Tamra, it has been explained as it is a virya of Lord Subramanya. So as soon as the name, the origin of this Tamra, when it is a virya of Subramanya, Lord Subramanya, so then one need to consider how it is Viryavat, then it is a Rasayana. Also, all Saptadhatu can be, Saptadhatu Poshana can be done one single drug, that is Tamra. It increases the Dhatwagni, it increases the Jataragni. So that way. So because without Saptadhatu means without nourishing the remaining other dhatu, Vira cannot be produced. So on that particular background, Tamra can be used in all Dhatugata issues with a different Anupana. So now let's analyze. As per the Rasaratna Samuchayakara, it is Pitta Pradhana, Kashaya Rasa, and Madhura Vipaka. So please, here, everyone remember, this is Madhura Vipaka. So why I am emphasizing Madhura Vipaka? Because everyone, we think the Tamra is going to be Ugra and Tikshna. It is going to how to use in Pitta related disorder. That particular point comes in the future. So due to the Madhura Vipaka, definitely somewhere it balances the Pitta. It is not going to increase the particular morbid Pitta in a different manner, but at least it helps in restoring the healthy Pitta in the body. Now, it is a Ushnavirya, it is Amla, it is Pitta Kafahara. If you look at what I was trying to say is, if you look at Rasaratna Samuchayakara, he clearly says it is Pitta Kafahara. Then Jatararuk, Kushta Hara, Amaja, then Krumihara, Urdhva Ada Parishodhana. Again, it is very important. Urdhva Ada Parishodhana. Let me explain here itself now. Urdhva Ada Parishodhana means with it helps in purification of the body, Urdhva Bhaga, Adho Bhaga. So when it comes to Urdhva Bhaga, Adho Bhaga, means even it can be it helps in detoxification or purification of Kapha, Vata, also Pitta Vata. So it where there is a means if the person is not fit for Panchakarma treatment like Omana Virechana, but you need to do that particular person need purification, but he is ineligible or he is not fit for a classical Vamana and Virechana, the Tamra Bhasma can be given in a daily manner. So it helps in doing Urdhva and Adha Parishodhana. So when I say Urdhva Adha Parishodhana, when there is no Panchakarmas are not possible in some XYZ person, so then what kind of a condition you need to consider? All autoimmune disorders, because in the all the autoimmune disorders, what happened over a period of time, however you do the Shodhana therapies, there is a repeated free radicals or repeated doshas will keep accumulating in the body on a daily basis. So there, for example, consider any skin disorder, skin diseases. In the skin, any skin diseases, specifically in psoriasis cases, atopic dermatitis cases, you do the Vamana or Virechana, and again after 1 month there is a symptomology will reoccur. So they need, even Acharya says in the Kushta chapter, the repeated Vamana Virechana has to be done. So how to do it in the present world? So in those kind of conditions, Tamra is the drug of choice. Now, it is Vishahara, Staulyahara. Then, according also it helps Kshayahara, Panduhara, Netram, helps in treating Arsha and Lekhana. It is having a Lekhana property. Now, according to the Basavarajiam, it is Tikta Pradhana, Madhura, and Kashaya. It is having a Lekhana Guna, Lagu Guna. Lekhana and Laghu Guna. Then comes Vishahara, Sara, same. It is almost, he keep on explaining the same thing. So this is the analyzation of each component of Somnathi Tamra, that is Parada, Gandhaka, Haratala, Manashila, and Tamra. Now, let's go with our main topic, Somnathi. Hello. Am I audible?
Yes, sir.
Okay. Now, so now, so the Somnathi Tamra. So as we were discussing, now the doctor, we can go to the 8th slide, please. Okay. So now, already we discussed what are the composition and all those things. Now going back to the dosage. The classical dosage is 2 valla, means Dvi valla. It is to be around 750 mg, which goes on to. So on a practical basis, in my clinical practice, I'm using half Rati to 3 Rati even in a single dose and a divided dose. Even up to the maximum for a few people, very few people, up to 3 Rati Bhasma also I given. And especially when there is the lot of dosha accumulations are there, where there is a lot of drastic dosages required, up to 3 Rati. But whereas comfortably up to the 2 Rati to 3 Rati, up to 2 Rati in a single dosage, you can comfortably give on a single dose. As of now, I haven't come across any complications by using 2 Rati in a single dose. So that is about in nutshell about dosages. Now, let's go with the Falashruti of the Rasaratna Samuchayakara, what he explains. With using or tagging with a different Anupana, it becomes Sarvarogahara. So, when you mix with a different Anupana and if you give, it becomes Sarvarogahara. Then it is Parinama Shulahara. When this quality of Parinama Shulahara, it goes to a gastric conditions, especially if you consider duodenal ulcer or the different ulcers in the different part of the intestine. If you consider it also, in both the condition, all the painful condition of the gastric system, this particular Somnathi Tamra can be used. And specifically, it is also Rujahara. If you go by the consideration of Manashila, it is Rujahara. Then Tamra itself, Rasaratna Samuchayakara says it is Jatararuk, means Amashayagata pain can be managed by the Tamra. So then the combination of Tamra and Shila together, it helps in treating the painful condition which is related to the particularly the digestive disorders. So that way, all gastric related pains and especially stomach related pain, which is both the before food or after food, both can be easily tackled with the Somnathi Tamra. Now, the next point comes Shulahara. What is the Shulahara? Already the Parinama Shulahara been explained. Again, why the Shula came. This Shula can be Nadi Shula. This Shula can be Siragata Shula. So, this pain goes to a musculoskeletal and neuromuscular condition, the Shula. This Shula need to be considered as a musculoskeletal and a neuromuscular condition. This that is about Shula. Now, Pandu, Jwara. Then when Pandu, Jwara, then comes Gulma, Pliha, Yakrit, Kshaya, Agni Sadana. This let's consider in one line. So this is Panduhara, Jwarahara, Gulma, Pliha, Yakrit, Gata, Vyadi. It treats. So if you mix together in any cancerous condition, when there is a metastatus, so you will see there is a hepatic related and pancreatic related issues are there. Then Gulma is nothing but if you consider it as abdominal tumors. So with the abdominal tumors, the pancreatic and particularly the Yakrit Gata Vyadi, and most of the cancer patient always suffer with the repeated fevers, the feverish feeling, then they will have a Pandu presentation. The Somnathi Tamra alone itself is sufficient to look after the Pandu, Jwara, and Pliha Gata Vyadis and Yakrit Gata Vyadis. You can consider that way also. And also you can individually analyze. Yeah, it is going to be a drug of choice in Pandu. If you consider Pandu as a hemopietic issues, the Tamra and Gandhaka is a main choice of drug in treating those kind of a hemopietic system. Then again, Tala is one among the best choice in treating hemopietic system. The Jwara, I don't need to explain how because of the Tivrata of all the drugs and Ushnavirya, so it becomes Jwarahara. Then Gulma, you consider it as abdominal disorders or abdominal tumors or anything. Gulma can be treated with this medication, Pliha and Yakrit Gata Vyadis. Anyway, I'm going to cover those things in the further slide. So the Somnathi Tamra is a drug of choice there. Then Kshaya, Agni Sadana. When due to the considering all the fact of metastasis and all those things, person is in the depletion or Kshaya pathology. Again, Somnathi Tamra is the drug of choice. Agni Sadana. Most of the cancer patients suffer from the Agni Mandya. So there, Agni, to improve the Agni, Somnathi Tamra is one of the best choice. Now, Meha, the Tamra, Haratala, presence of Shila, definitely it helps in treating diabetic condition in all the way. So one common drug can be your Somnathi Tamra. Even the diabetic patient with emaciation also you can easily use it. Kshaya is nothing. Kshaya is the word which helps in understanding the emaciation in modern terminology. So even the emaciated diabetic person also can be Somnathi Tamra can be delivered. Then Mula Amayancha. Again here there are several books which explains the Mula Amayancha is nothing but hemorrhoids or piles. So definitely there is no second thought. All the drugs which is existed in this Somnathi Tamra helps in treating hemorrhoids. But Mula Mayancha also can be considered in consideration goes to a Sroto Mulas, means Udakava Srotas, Raktava Srotas, Pranava Srotas, where there is for example, Pranava Srotas. The Pranava Srotas Mula is Hridaya. When Sroto Mula itself is having a trouble, to troubleshoot the Sroto Mula, the Somnathi Tamra is the drug of choice. Because when the Sroto Mula itself is affected with doshas, definitely the remaining, whatever the Srotas which go and ends and everything will get impact. For example, in the Raktavasrotas, Yakrit is the Mula. Yakrit, when it is the Mula of Raktavasrotas, when the Yakrit itself is got means when it start to have a dosha imbalance, or when there is a pathology is lying down in the directly liver, definitely the blood production and other things will start to get impact. If you go by the law of Sushruta, the sthana samshaya prasara, all shatkriya kala, the prasaravastha, when it goes, definitely the doshas will start to spread through that particular raktavasrotas. So to treat the sroto mula, Somnathi Tamra is a drug of choice. So it can be a choice of all the srotas. You can name it. I can say only yes. Like pranavasrotas, definitely can use it. The Tamra itself is a consideration in treating pranavasrotas. Manashila and Haratala, everyone knows it is a drug of choice in all pranavasrotas. So similarly, Raktavasrotas, Rasavasrotas, and Masavasrotas, those things I will tell you. Then how it can be utilized in the Astivasrotas also I will tell you. Then even to the extent the Somnathi Tamra is a drug of choice in Shukravasrotas as well. So in all Srotogata Vyadhi, Somnathi Tamra can be utilized. It can be utilized in the permutation and combination with the other drug. Now goes on to the Dushtancha Grahani. So now Grahani Gata Vyadhis, what is the need of Somnathi Tamra? Already there is a Parpati Kalpana, there is so many things. Then where is the clinical need of Somnathi Tamra in treating Grahani? So when there is a the Grahani condition reach to the particular chronicity, and you will start to experience, or you start to see in your clinical routine sorry, emaciation pathology, and they're absolutely they won't respond. Few days they respond, and again the symptoms will start back, and there is a lot of sequelae. The disease sequelae is happening, and there is a you are able to appreciate there is some amount of dosha depletion, dhatu depletion, and person going into the depletion pathology, and he's losing his appetite, means where he's losing his agni, and he keep on losing his particularly dhatu, the appropriate balance of dhatus is getting affected. Then Somnathi Tamra is a drug of choice along with the Swarna. Then you'll be able to control the disease spreading in the body. So that is how in the Dushtancha Grahani means one need to consider the very severe chronicity of the Grahani pathology. So that is how I use it in a lot of clinical pathologies of colitis severe. Not in the beginning stage of colitis, of course it can be used, but in the severe state of colitis is a drug of choice. Then it becomes a choice of drug in several irritable bowel syndrome also. I use it in a different manner. I will go by in the next slides. I'm going to consider those things. So this is in nutshell about Somnathi Tamra Falashruti explained by the Rasaratna Samuchayakara. So doctor, if you don't mind, can you go to the first slide? So in the first slide, in the very first slide, Somnathi Tamra is being explained in a different methodology, like Valuka Yantra, Garbha Yantra. The Rasaratna Samuchayakara explained the method of preparation, Valuka Yantra, Garbha Yantra. I'm not going to cover in detail because Dr. Pat Kale and his team will explain to you about all those things. The Valuka Yantra method, Garbha Yantra method, then Rasaprakasha Sudhakara, he explained about Sharava Samputa method. Then Yoga Ratnakara emphasizes on Kupi Pakwa. So in my clinical practice, both the Garbha Yantra method also I used. Then Lavana, even I used Lavana Yantra method instead of Valuka Yantra. That also preparation we done. Then Kupi Pakwa is now going on. So as of now, the Valuka, the Lavana Yantra method and Garbha Yantra method we are being used, and we have an excellent result in both way. We didn't find much of any difference in that particular the way of preparation and the clinical implication. But it will be very interesting to see how it is going to be with the Kupi Pakwa, because when we are preparing with the Kupi Pakwa, we are having a certain clinical, so the means the preparation challenges. So because there is some amount of the bhasmas, which is means some amount of material which is left in the bottom, then something is at the Kanta Pradesha. So we are yet to decide what to do with that. Okay, now directly clinical utility. It is, see, this clinical utility slides, whatever you're going to see, it is in my own practice and what I am using based on my clinical understanding of the diseases. So at the end of my talk, the session is open for the question. You are most welcome to ask any question on any of these things. What is my understanding and why I am using? I'll be able to means I will try to explain in best of my best. Whatever my understanding about the subject. Okay, so in a very brief, in all different CA pathology, I'm going to explain. So the Somnathi Tamra will I'll be uttering word as a ST henceforth. Now, it is a blind choice in all the CA and metastasis. Now, in the bladder CA, in the urinary bladder CA, the most of the times urinary bladder cancers are, most of the times it is a adenocarcinoma, and most of the times it will be there in the anterior part of bladder or the dome of the bladder. So when there is a urinary bladder CA, the particularly Somnathaya and Vanga Bhasma and Naga, these three combination, along with that you can mix and match your the Anupana whatever you want based on the particular symptom. For example, if there is a urinary obstruction, there is the particularly the Mutra Srava is not proper, there is a Mutra Ghata, I may mix with a Gokshuru Churna. Or if there is a lot of the frequent urination is there, then there is a residual urine is the residual urine is there, then I may go with the Punarnava or Brihatyadi Kashaya. Then if there is a lot of urinary reflex is there, then I may go with the Virataradi Kashaya. So that is the reason I have not mentioned any Anupanas here. My main kalpa, what is my main kalpa I am mentioning here? The Somnathi Tamra, Vanga and Naga is my drug of choice, not only internally, the externally. Means also we push these bhasmas mixing with the ksharataila, or in some people, I may choose to mix with the Pipaladi Anuvasana Taila. We mix with these and we directly do a Uttaravasti with these particular combination. There is a, if anybody you can access Vangakshara. There is a very beautiful Vangakshara and Nagakshara is available in Siddha medicine. If that particular Vangakshara and Nagakshara were in two patients we are able to arrange those ksharas with the Vanga and Naga, then it is beautifully worked in adenocarcinoma. And on a regular practice in Somnathi Tamra and Vanga and Naga, when we mix with the Kshara Taila and when we are pushing into the bladder, the anterior and posterior wall, the posterior wall also not so common, but anterior wall is common. The tumor which is stays in the anterior and posterior wall, which get treated easily. But whereas in the dome of urinary bladder, the medicine reaching is not so effective. Even we try to mix with like Varna Kanchanara Kwata, we increase the quantity of liquid, but still the reaching the medicine reaching into the dome is not so easy. That's how the adenocarcinomas, which is existed in the anterior and posterior wall, get easily treated, and we are able to appreciate within 3 months there is a drastic change in the tumor size in the anterior and posterior wall. But whereas dome, we are not able to appreciate that amount of result. Then also this particular combination helped in removing the some amount of unexplained hydronephrosis was there. That also we were able to treat with that particular combination. Now let's move on to the lung pathologies. in the all lung carcinoma, whether it is a primary or secondary, like the primary tumors, if it is starting from the lungs, or as a secondary when the lung got its tumors. The my main choice will be like the Somnathi, Tamra, and the Vishagarbha. Again, already in the Vishagarbha also there is a similar component, and in the Somnathi, Tamra is also same component. But to get the more efficacy and to control the disease spreading, I go with the Vishagarbha. Again, Vishagarbha is also comes with a Rasa Karpura. It acts quite fast. So these are the two choice. Otherwise, so in some cases I mix with a Malla. In lung pathology, my choice always goes towards the Malla. Somnathi, Tamra, and Malla Bhasma or Malla Sindhura, or sometimes Malla Garbha totally, based on the how the severity of the disease and the Roga Bala. I choose to go with the Malla. If the Rogi Bala is good, Malla Garbha totally will be my choice. But whereas, for example, if there is a lot of exertional dyspnea is there, then there is a hypotension is there, then I may choose Somnathi Tamra with Malla Chandrodaya. Hypertension as well as exertional dyspnea is there, then I may choose to go Malla Chandrodaya for 7 to 14 days. Then again, Shila, again I will add on based on the how much is the tumors are existed in the lung. So many times in my clinical practice, what is happening, combination of Somnathi Tamra and these particular Malla or Shila or Vishagarbha Potali, which within the 14 days we will get symptomatic relief in maximum case. In maximum case, you will get it. And after some amount of inflammatory markers are reduced, and once the ama means ama nirana condition comes, then you can add on Sahasrapati Abraka to the same combination. You will have a lot of symptomatic relief. See, to appreciate the changes in the lung pathology, the tumor size, all these things, you should literally work more than 3 months, 6 months. You have to keep giving medication and all those things. So here it becomes a very basic choice of medicine. Again, if you ask me, Anupana, sky is the limit. In a few people, you can give Dashmula Kadatradi Kashaya. In certain people, Nayopaya Kashaya. In some people, we can go with the Pushkar Mula Churna or Pushkar Mulasa you can give. In certain cases, the plain Dashmula Kashaya is a drug of choice. In certain cases, Balachirakadi Kashaya, Balachirakadi and Nayopaya, where there is a Kshaya is or emaciation being set in, then you can go for it. So that is how nowhere I mentioned particularly Anupanas. Now in all the maximum meds, when there is there is no clear-cut indication what to do in that particular condition, close your eyes, go with the combination of Rasa Karpura, Somnathi Tamra. Yeah, when I say the Rasa Karpura, the particularly you can always go by the Rasaratna Sarasangraha combination of Rasa Karpura. So that particular Rasa Karpura with the Somnathi Tamra and Loha Bhasma, and that to be Tikshna Loha Bhasma if you take, then any particular, this is a one combo, it can be blindly used in all metastasis condition without any fear. And if the patient affordability is there, just add on Suvarna Bhasma. Then you will be able to control the spreading of the cancer in the body. Then in brain-related cancers, the Somnathi Tamra, Suvarna and Vacha, this is the one particular combination which helps in spreading the disease condition. And even now presently we have 2 astrocytoma cases of the brain. One is from the Uttar Pradesh near Jhansi, and one other patient from near Andhra Pradesh. So both were in a very deeply situated, so they were unable to do the radiation therapy. The patient was on basic chemotherapy cycles. So of course the surgery was it is ruled out, means he was unfit for the surgery because it is in the deeper in the brain. So after the chemotherapy, still patient developed complete paralysis and all those things, and he lost his swallowing reflex and speech. So with our medication, within the 2 months of, we gave Somnathi Tamra, Suvarna Bhasma, then there is something called as Chandanadi Kashaya from SNA company. Along with that, we added also particularly combination of Nagabhasma and I think, if I'm not wrong, Loha. So I'm not sure, but the Somnathi Tamra and Suvarna was the major drug of choice. So yes, Vishagarbha Potali was also given. So with that particular combination, so within 1.5 months, the patient started to walk. He is able to talk. Now he is out of the rails tube. So, and also after the 4 months, they repeated the MRI. There is a reduction of overall 3.2 mm of the tumor size is been shrunken. Even the oncosurgeon is said you can continue the medication. They try to do the LFT and KFT. It is absolutely fine. In fact, the post chemo, there were lot of dearrangement in the LFT after our medicine. Means the combination of these medication, his liver function dearrangement, everything is being treated. So that's about brain-related pathology. And now coming to the breast-related pathology. In all breast-related CA and METs, the Somnathiya, Loha, Rajata with Rasapachika and Raktapachika is my choice. It is a basic choice. The reason is the Loha. Again, see the when it comes to a Sroto, yeah, okay, here you can consider a Srotas thing. When it comes to a Rasavasrotas, the Artava and Stanya is Upadhatu, correct? So in that particular consideration, Loha Bhasma is Rasagata, Rasavahasroto Vadi, Loha Bhasma is the choice. Then Rajata is a choice of choice in the Udakavasrotas. Always the breast related CA pathologies goes to a lymphatic system. Always the breast cancers affect the lymphatic system. So in that particular base, to safeguard the lymphatic system, Rajata is the best choice. Then Loha, being a main Rasavasrota, when we treat Rasavasrotas, Loha is a ultimate choice. So Somnathiya act as a Arbudhara. So all these combination along with the Rasapachika and Raktapachika, you can keep it as a one particular combo, which really literally helps in preventing the furthermore spreading of the disease. But see, all the breast pathology recently, the ductal carcinoma and papillary carcinoma, which was a set pathology, the PET scan was showed 99 means the almost the confirmed case of CA of the ductal carcinoma. So we did this combination along with Hemagarbha Potali. We gave. Along with that, we also gave the application on the particular the breast means on the nipple and areola area. We gave the applications of Patanga, then Shila, then Tila. These combination we gave it, and immediate within a week time, there was a complete cessation of secretion from the nipple. And 3 months she continued the medication, and eventually she went for a resection. So in the resection, it came, the ductal carcinoma came as a negative, and it shows just the inflammatory markers. So this is a way many times it works. I have both the report, like the PET scan and MRI showed clear infiltration, but even we were surprised, and actually the biopsy was repeated twice. So apart from that, the maximum breast CA by the time which reaches me already, the tumor is being removed. Then a few cycles of chemo will be done. So the maximum time on the breast cancer, out of 10 cases, all the 9 cases I will be working along with the chemo and radiation. So I don't want to give a false statement. This combination is more than sufficient just to prevent to treat the existing tumors. I believe any tumors are there, it needs to be removed. Now in Bangalore, we have one particular oncosurgeon. Definitely he's from the allopathic perspective. He believes a lot in Ayurveda. With him, we both work together. He removes the tumor, then we add on our medication. So that way, it is easy for me to manage here. Now, the blood-related any pathologies, like the CA related to the blood, hemopoietic system, the Somnathi, Tamra, and Rajata is a major drug of choice along with that Loha. So the Somnathi and Rajata is the main components. Even the acute leukoid leukemias or all the AML, all these things, the main choices Somnathi, Tamra, Rajata. In few cases, I may use even Hemagarbha. Of course, without Suvarna, it is very difficult to consider, but still, this is the main composition. Now, when it comes to a lipoma, Somnathi, Tamra, and Shila. So, we had musculoskeletal related, in the spine at the dorsal 6, 7, and 10. There was a particular liposarcoma. It has been removed. So there was a lot of trace element left because which was attached to the myelin sheet, and which was greatly appreciated in all MRI, and there is a particular sliced MRI. The combination of Somnathi, Tamra, Shila. Again, Shila Garbha I gave. These two combination, believe me, within the span of 42 days, there was a reduction of whatever the trace element they left. Almost there was a reduction of 70%, and then there was whatever compression was happening with the trace element, which is reduced, and symptomatically the patient started to feel much better. The CA related to the lymph nodes and all those things, again, Somnathi, Tamra, Rajata, and Loha is a drug of choice. Now, moving on to clinical utility of Somnathi, Tamra in the gastrointestinal disorders. Now, H. pylori. There are several cases in my table. H. pylori with the help of Somnathi, Tamra, you can any chronic H. pylori cases also as a single herb, single drug. You can use this Somnathi, Tamra to treat all H. pylori cases. Within normally 1.5 to 3 months, you will get a negative biopsy from the H. pylori. Even up to if the patient is really Kaphavata Prakriti, then you may need to use the higher amount of the 2 Rati BD doses. Otherwise, normally the sensitive people, you can go by the half Rati to 1 Rati 3 times or 2 times is more than sufficient. So in the chronic acidity condition where there is a erosions, there is a sclerotic presentation is there in the gastric mucosa, and especially when it is sclerotic and especially erosion pathology, Somnathi, Tamra, Pravala, and Giloya with the help with a dadima juice will be the great choice to treat chronic acidity people. Till the date, not even one single person I came across with any complication. So in all the chronic acidity people, Somnathi, Tamra, Pravala Pishti means Pravala Pishti with not with Arkadugda, normally with the Pravala Pishti with rose water combination what we prepare. With that, Giloya and Dadima Swarasa is my best choice. Even this one single composition is more than sufficient. In few people, I may give Avipati Churna daily night around 1.5 teaspoon. Otherwise, this single combination is more than sufficient to treat chronic acidity. Then normally, if they have too much of chronicity, then it may take 2 to 3 months. But eventually, before the 3 months, the medicines will be tapered down and they will be doing much better. Then we will shift them onto a very based on their condition, other drugs will be started. But in the chronic acidity, this combination always works with us. Then in the chronic gastritis, what is I meant as a gastritis? There is no acidity involved, that there is no burning sensation in the chest, no sour belching is involved, but always they feel heaviness in the abdomen. They feel hungry, but eating with very little quantity, they will feel fullness of stomach. In that particular kind of a condition, in those kind of chronic gastritis condition, Somnathi, Tamra with the Hinguvachadi or Bhaskara Lavana or Chiruvilvadi Kashaya. Where I use Chiruvilla Kashaya is Somnathi, Tamra, where there is a improper evacuation of the bowel, constipation is there, then Chiruvilva I use. So this is basically you consider it as a gulma and you can treat on that particular base. Then in the chronic colitis cases, even with a bleeding pathology also, Somnathi Tamra with the Pravala Panchamrita is the single drug of choice. And there is a chronic colitis and there is a Dhatukshaya. Then Somnathi Tamra, Vanga and Suvarna. This is a combination. Along with that, certain Medhya drugs, otherwise Sahayoga Dravyas like Majjapachaka, Musta will be there. This is my line of treatment in all chronic colitis cases. Even in the, if it is a very starting stage, my drug of choice will be the Bhasma Kalpana. But in the chronic colitis cases, for bare minimum 42 days, means 1 mandala or up to 1.5 mandala, Somnathi Tamra I given in many cases. Then, hepatic system. In all hepatitis condition, in the common jaundice also, the Somnathi Tamra, Katakarohini or plus Patola, that will be my drug of choice, or any Tikta Pradhana Dravya. If you add up, all hepatitis condition can be easily treated, and you will be able to appreciate changes in the direct and indirect bilirubin. Then you will be able to appreciate SGOT and SGPT changes. It literally tackles immediately. Even many hepatitis cases to control the fever, I won't give anything. This combo is more than sufficient. Again, they will be on a very strict diet in hepatitis condition. When it comes to hepatomegaly pathology, my drug of choice is Somnathi Tamra with the Rohitaka or Varna Kanchanara, and sometimes Somnathi Tamra with the Shigrutukmula. In Somnathi Tamra with the Shigrutukmula, my choice goes to hepatomegaly with the cyst. Hepatic cyst will be there. Then you can give Somnathi Tamra with the Shigrutukmula. In specifically, when there is a lot of condition where there is a hepatomegaly with also you will be able to appreciate some amount of fat accumulation, plus there is a steatosis, there is a chance, then go by the Varna Kanchanara. It will be really good. Then hepatitis related hepatomegaly, the Somnathi Tamra with Rohitaka is the drug of choice. In all cirrhotic pathology, Somnathi Tamra with the Kumarasava, or if it is the post-viral condition, then and also if there is a portal hypertension, then I go by the Somnathi Tamra with the Vasa and Guduchi combination. And in many combination, in all this cirrhosis pathology, Somnathi Tamra with the Loha is also drug of choice. Now comes clinical utility in the spinal disorder. So in all spinal disorder, if there is a stenosis pathology, Somnathi Tamra with the Naga is my choice. In disc protrusion, Somnathi Tamra with the Loha, and in if this is a combination of some cyst or some particular lymph nodes enlargement in the spinal disorders, then Somnathi Tamra with the Rajata is my combination. And appropriate Anupana. You may take Kupilu, Vishamushti, or Rasne Randadi Kashaya, Rasna Panchaka Kashaya, Maharasnadi Kashaya. It is entirely based on particular your yukti. You can keep choosing this thing. So here the Somnathi Tamra can be utilized as a Shulahara. That particular qualities of Somnathi Tamra, when you go, there is something called as Shulahara, Nadi Shulahara. Please apply here, then it literally works. Then in osteoarthritis condition pathology, where there is a sclerosis, blindly use Somnathi Tamra. Means there is a hip joint sclerosis due to the degenerative condition. To prevent furthermore sclerosis and to prevent due to the sclerotic changes, whatever pathophysiology changes is happening at the joint level, drug of choice is Somnathi Tamra. Then menstrual disorder. I'm not going to go into the other details. Let me consider only the pathologies of PCOD and PCOS. Then the PCOD related issues, Somnathi Tamra, Trivanga, Loha with a Sukumarka Kashaya or Shatavari or Kuberakshavati is a drug of choice. Then in PCOS related, as you know, the PCOS issue is with it is a multi-systemic disease with there is a lot of involvement of other organs as well as other endocrinal system. So that is how here the wide range of bhasmas will come into act. Somanathiya, Rajata, Loha, Trivanga, Gandhaka. Then either you go with a Trivanga or depend upon the case to case, you can choose to give Trivanga Bhasma separately. Means Yashada, you can go with the Yashada separately, Vanga separately, Naga separately. Then in all PCOS condition, I keep giving Abraka. Even in PCOD related case also, Abraka will be the drug of choice. Abraka as well as Gandhaka. Again, all PCOD, PCOS related pathology, Abraka and Gandhaka will be my choice. Now, along with that, you can use Varuna, Kanchanara, Shatavari, Sukumara, Tiktaka Ganakashaya, or Lekaniya Ganakashaya, or the Medha drugs will be the choice. So with this particular combination, you can tackle the PCOS. So for example, when you are treating PCOS cases, particularly Trivanga, there is a Yashada Bhasma. Yashada Bhasma I may choose to give in between the meal. In means Samana Kala. Samana Kala, if you give, if there is a insulin resistance, if it is proved by the blood reports, and if the lady exhibiting the symptoms of insulin resistance, then give Yashada Bhasma in between food. So likewise, if the person is the really obese, then just rather than Vanga, directly go by the Naga. So based on their presentation, their Prakriti and Vikriti and symptomology, you can choose to give Trivanga either in the compound form or in a separate in separation when there is a Rajata. So in PCOS related cases, there is a repeatedly there is a endometrial thickness is happening. Then there is a always the uterine inflammatory changes is keep happening. Then there is a chances where there is a implantation is getting failed. Then Rajata is a drug of choice. So when I say Somnathi, Tamra, Rajata, Loha, Trivanga, don't mix everything together. These are all drug of choice, but all PCOS condition, Somnathi, Tamra is a common drug of choice. In the PCOS with a different symptomology, Somnathi, Tamra can be utilized as a single drug. Along with mixing with these mix and match, you can mix and give. So then definitely there will be a lot of symptomatic relief, and appropriately in many cases ovulation being properly set in. So this is in nutshell about the PCOS. So with this, I'm taking a break for my explanation. So session is open for the question. You're most welcome to ask any question.
Yes. Thank you so much, sir, for such a detailed explanation about Somnathi Tamra Bhasma.
Thank you, Doctor.
So, yeah, you can ask your doubts in the chat section. Mostly, sir has covered a wide, extensive use of Somnathi Tamra Bhasma, starting from cancer to osteo diseases, gastritis, and much smaller diseases in which we don't usually think of applying Somnathi Tamra Bhasma in our diseases. So, thanks for such guidance, sir.
Thank you, Doctor. Thank you. Okay, Doctor. Thank you. Okay. Oh. No. Okay. There is I think one question is there. Can we use it in hypertension? So directly when you say, you mean to say the portal hypertension or normal, the generalized hypertension? If it is a generalized hypertension, I never used because there was no, for me, I never got into that particular pathophysiology, means sampratyagatana. But in the portal hypertension, definitely yes. Not in the not in the hypertension condition.
The further question was, sir, can Somnathi Tamra Bhasma be given in children's or pediatric usage?
Yes, yes. I given in the very youngest child. What I used is even 3 months baby. Also, I given Somnathi Tamra with particularly the liver pathology. There, what you need to do is the in a 3 months baby. How much is this thing? I gave around 10 mg. The 10 mg of Bhasma as a single divided dose I gave. Safely you can give. If the preparation you are confident, please give.
Okay. Next question is, can Somnathi Tamra Bhasma be used in pancreatic cancer cases or in pancreatitis?
See, in the pancreatitis, I'm using Somnathi Tamra. Pancreatic cancer also I'm using. Even where there is a pancreatitis cases with CA, particularly the CA125 is elevated and alpha lipoprotein is elevated, Somnathi Tamra literally tackles them. But when you are using pancreatitis cases, you should be little careful. If the person is having a kind of a reflex, then many people will have this reflex esophagitis kind of a symptom. There, you need to give some Pittahara drug like Pravada Pishti or Indukanta Kashaya, like that you have to give. But definitely it helps. And now we are planning to use this. Now we are planning to use the Somnathi Tamra, which is prepared by the Kupipako method in the pancreatitis cases to treat. We are trying our. We started already twice. We repeated the same Somnathi Tamra, means 2 times we done the Janana. Now after 18 times of Janana, we are planning to use. Definitely, blindly you can use pancreatitis and pancreatic cancer Somnathi Tamra. Though no means which doesn't stop you not to use.
Okay, sir. So next question was, can Somnathi Tamra Bhasma used in hepatitis conditions, specifically in hepatitis C?
So the hepatitis C also you can use. Only thing, see the hepatitis A, B, C. What are the sign and symptoms? Based on that, you can tag your Anupana. But all hepatic condition, Somnathi Tamra, either Patola Katurohini, if you get separately, that is well and good. Otherwise, Patola Adi Kashaya, Patola Mula Adi Kashaya, Patola Katurohini Adi Kashaya is a drug of choice. If there is a some amount of thrombocytopenia is there, if the platelets are literally going, if it is falling down, then use the Vasa Guluchadi Kashaya or Vasa Kshara along with the Somnathi Tamra.
Okay, sir. Next question was, can this be used in CA, in BPH cases, in benign prostate hypertrophy?
Yes, absolutely. Absolutely. There again, you can add on Vanga based on a particular symptom. And if there is no metastasis, because in all the prostate cancer, the particularly the if it is going into the metastasis, the directly it affects the spinal means vertebral column. The prostate cancer always a risky, because once the spreading start, it directly go into the bone. So you need to literally on your toe to give the maximum tolerating doses and try to control the disease spread. So Somnathi is one drug of choice. Along with that, always make sure with the prostate related issues, you use Vanga, Naga in a good manner. Along with that, Suvarna. The Somnathi Tamra can be utilized. No second thought about it.
So are there cases in which splenomegaly has been treated by using Somnathi Tamra Bhasma, drug of choice?
See, again, the Srotomula concept, if you go, the cloma and other things, so definitely splenomegaly can be treated as directly Rasaratna Samuchayakara itself, he keeps saying, the Yakrat Pliha Gulma. So always when the hepatomegaly condition comes, the most of the times even spleen is being affected, splenomegaly, it take care. It is in the process. There is no second thought about it.
Okay. Next question was, are there any cases in which Somnathi Tamrapasma has been given externally, like on LEPA for tumor or any other
Yes,
conditions?
as I in the beginning itself explained, in the adenocarcinoma of the urinary bladder, we pushed inside. In the oral cancer, we apply the Somnathi Tamra externally. Then in the larynx, and now we have two esophagus cancer cases. So although they done the radiation, but there is no much of this thing. The that post radiation, there is the tumor got into the wound state. So now Somnathi Tamra we are using as a painting tool. What we are doing is Somnathi Tamra is mixed with the honey, and we ask the person to swallow. So that particular application also, the externally, it can be used. And in gangrene cases where there is a dry gangrene, so Somnathi Tamra application with Jatadi Taila also can be used. It act as a Rana Lekhana. So then slough tissue and all those things can be easily removed by this.
Okay, okay. So, someone has raised their hand. Wait, Pachiti Patwadin, ma'am. You can unmute yourself and ask the question, ma'am.
Hello, good afternoon, sir. I wanted
good
to
afternoon.
ask, as it is a combination of Hartal and Manashil, can it be given in chronic renal failure?
No, I never dare to give chronic failure cases, but
Okay.
only once in the chronic renal failure cases, when there was a due to the renal failure cases, the person started to have a particularly the liver function started to derange a lot, and there was a condition called as the encephalopathy, hepatic encephalopathy. Person started to have, and the pressure started to rise like anything. So to control the particular situation, the Somnathi Tamra along with the Somnathiya Tamra, that to be the means the Rasamarita Suvarna Bhasma is been given only for 3 days. Except that
Okay.
condition, till the date I never used in renal failure cases.
Okay. Thank you, sir.
You're welcome, ma'am.
So that's for the doubt session, sir. If anyone is having more doubts, you can just message us on our Instagram page, or we'll forward those questions to sir. So thank you so much, sir, for such deep discussion on Somnathi Tamravasma. I'm sure that it would help many of Vaidyas which are still not using Somnathi Tamra in their practice, because it has a very wide range of application. Thank you so much, sir, for explaining it.
Yeah, thank you, doctor, and thanks for Dr. Patkal and all of you. Thanks for the opportunity. Thank you.
Yes, yes. Thank you, sir. Yeah.